The Mind Deconstructed, Mental Health and Wellness with Dr. Kaz and George.
I'm Dr. Kaz Nelson, an American Board of Psychiatry and Neurology certified psychiatrist licensed to practice medicine in the state of Minnesota.
I'm your podcast host, George. I'm a licensed attorney in the state of Minnesota, but I'm not here to give you legal advice.
The statements of Dr. Kaz and George are not a substitute for medical care, and our opinions are our own. If you are experiencing a mental health emergency, please seek assistance from a professional.
You can contact us on Twitter at MindDeconstruct. On today's episode, Bipolar Disorder Explained. Welcome back, Dr. Kaz. It's good to be back on the mic with you.
You too, George. We had a little break, but now we're back at it.
Yeah, it's always good to be speaking to you and speaking to our podcast audience. Are you excited to get an episode out there?
Yeah, I really enjoy this and have had a lot of positive feedback. And anytime we can all learn more about mental health and mental illness together, that helps bring us together and move us forward as a society.
And just a reminder to our listeners, please subscribe to our podcast. You can listen to it on YouTube or Stitcher or Apple Podcasts, basically anywhere you can find podcasts, we are available there. And if you want to leave us a review on Apple Podcasts, that would be great.
iHeartRadio was recently added too.
Oh yeah, you can listen to us on iHeartRadio. Dr. Kaz, have you tried asking your smart speaker to play the Mind Deconstructed podcast?
I've asked probably hundreds of times and it hasn't worked yet once, but it should work in theory, so still troubleshooting that.
If anyone can get their smart speaker to play the podcast, let us know. Starting off our program with our hot topic in mental health, Dr. Kaz, we are going to be back at the Minnesota State Fair, aren't we?
So delighted and honored to be asked back by the National Alliance on Mental Illness and the other sponsors of the second annual Mental Health Awareness Day.
And that's going to be August 26th, Mental Health Awareness Day at the Minnesota State Fair. And NAMI has a pretty big area in Dan Patch Park with a stage and a lot of local organizations set up booths there, all dealing with mental health. And Dr. Kaz is going to be on the stage from 10:45 to 1:45 on August 26th, emceeing the program there.
Yeah, I really hope to see you there, even if you can only join for a few minutes. The acts are really inspiring and heartwarming, as you can probably imagine. People who are coming together around the idea of mental health awareness. I hope you can make it.
And you did such a good job last year. Last year you had like the 7 a.m. to 10 a.m. like graveyard shift or reverse graveyard. But this year you got a prime time, 10:45 to 1:45. They're moving you up.
It might have just been who was available, but you know what? I'll take it.
And we did a couple Facebook Live segments from the fair last year of Dr. Kaz speaking to the audience there. Maybe we'll get a chance to do that again this year. So if you can't make it to the state fair, maybe check us out on Facebook Live, August 26th.
Yeah.
Bipolar disorder, that's one of the big ones that people hear about.
Yes, it's one of the main mental health disorders that we see in our work in psychiatry, along with some of the other mood disorders, or we've also talked about psychotic disorders. Bipolar disorder is one of those that can have mood components and also components of psychosis and can be a common reason why somebody might be presenting for mental health care.
Dr. Kaz, I saw an article in USA Today, I think it was just a couple days ago, featuring Carrie Fisher, and she was a celebrity living with bipolar disorder. And she passed away a couple of years ago, but she's still making the news for her advocacy for bipolar disorder. And there's actually a book coming out written by Sheila Weller, and that kind of goes through a little bit about how stigmatized bipolar disorder is, especially for women out there, and how much work Carrie Fisher did to try to combat that.
Yeah, she was such an inspiring public figure and celebrity for being open about her diagnosis of bipolar disorder, open about some of the consequences, some of the barriers that this posed for her. I think many people with bipolar disorder would also say aspects of the illness can also help to make them who they are. Sometimes aspects of bipolar disorder can help with artistry or creativity in some cases. And so you do see people in the public or well-known figures, some of them with bipolar disorder. And I'm grateful that she was open about it and the impact so that we can all talk about this together and people with bipolar disorder can feel represented and less alone.
Yeah, and she's not alone out there, certainly not even among celebrities. Demi Lovato, Mariah Carey, Catherine Zeta-Jones, Kanye West have all talked about their bipolar diagnoses. And so hopefully they are all kind of moving the needle a little bit about the world's population's understanding of the disorder.
That's right.
Dr. Kaz, we've already talked about bipolar a little bit, but what exactly is bipolar disorder?
That's a great question. And medical science is still trying to understand exactly what it is or exactly what causes it. But what is seeming to happen in the brain of somebody with bipolar disorder is that there are areas in the brain that have to do with mood that have abnormal activity. And what this results in is somebody with bipolar disorder might have weeks and weeks of a type of mood state called mania, or another way we might say it is somebody is having a manic episode. And people who have manic episodes go weeks and weeks of needing very little sleep. So they might only sleep an hour or two a night or no sleep at all, but not feel fatigued, not feel exhausted, still have lots of energy. They might have a lot of grand or big ideas, like starting one business, then a second business, then a third business. They might be building things, creating things. They might even think that they were sent on a mission, or they might have some religious or spiritual ideas. Sometimes people with mania will come in and say, well, I'm the next Jesus Christ, or I've been sent here by God on a mission. Sometimes people have some of those psychotic thoughts, delusions, and you can imagine how upsetting that might be to a family member, because the insight about this being abnormal is generally not felt by the person at the time. So the person experiencing the mania thinks this is normal or something good that's happening to them. It might even feel good. And family members are saying, whoa, you are not yourself. You're not sleeping. You're believing some unusual things. I don't think you should spend all your money that you've been saving for the last 10 years on this business. It seems like a bad idea. Even people can engage in sexual activity, have encounters they wouldn't have otherwise, spend money. It's very distinct and unusual pattern for those people when they're in this episode of mania.
Yeah, I was going to ask, well, what's the downside if you're a creative person and you get really creative and you create, and maybe you're an artist and you make a lot of art, whether it's good or not, but you're out there, you're doing it, you don't need sleep, but you kind of already spelled out a lot of the downsides.
Yeah, oftentimes it crosses the line into severe consequences where when the episode is over, people often have tremendous regret or have spent money or have exposed themselves, to sexually transmitted illnesses or different things that they wouldn't have otherwise, and then can often feel a lot of shame. And part of this pattern is that people may have the mania, but then also periods of very serious depression that go along with it. And oftentimes those periods of depression can follow a manic episode. And it's complicated by the fact that people do feel a lot of guilt and shame naturally about some of the things that happened in the mania. And, there are examples over time of people who have used their mania to accomplish great things, lead battles or create wonderful pieces of art. And so that's why this is always a difficult conversation with people, particularly people in the artistic community, because people say, oh, I need my mania to accomplish these great things. And we're not in the business of telling people what they can or can't do, but only making sure that people understand the risks and benefits, and that we partner with people to say, okay, but how do we manage this? How do we treat this to prevent some of those downsides and consequences that you would then later regret?
I mean, not everyone's a great artist. Not everyone's creating a number one album, in a manic state. So it'd be really challenging, I would think, for those family members or people around you. Like, oh, your mom bought you a Cadillac, like when you know she doesn't have any money, and she bought your sister's a Cadillac when you know she doesn't have any money. It's like, well, this isn't a good thing. Yeah. So then how long are these up? I mean, like, is it up and down? Is it 2 days of mania, 2 days of depression, back and forth? Like,
Well, for the criteria of the disorder, it states that manic episodes need to last on the order of weeks in order to be considered bipolar disorder. So many people have had that experience of maybe even feeling a little bit of that manic or high energy feeling for a day. Maybe you had an extremely productive day or a creative day or one where you were kind of in the zone and ideas kept flowing. That's just a little taste of what that might be like. But if you had one episode of sleepless night or one night where you pulled an all-nighter because you had a ton of energy and wanted to get something done, that does not meet criteria for bipolar disorder. There is a condition called bipolar disorder type 2, where the manic states are not as extreme and you don't have the delusions or psychosis, but you have some extra energy and some reduced sleep for weeks at a time, but not to as large a degree. And so that's called bipolar 2. But if you're noticing that a pattern of mood tends to be hours or minutes or days before the moods switch, then you're looking more in the realm of something like emotional dysregulation. That could be due to previous trauma. It could be due to borderline personality disorder, or even a medical condition like a thyroid disorder or something like that, where you're having a lot of mood instability moment to moment or day to day. We generally do not think of that as bipolar disorder.
and with bipolar, do you need to have the downs with the ups? Like, are there people that have manic episodes and then are pretty regulated when they're not in that manic state, or does it automatically come with that depressive state?
Well, if somebody has mania, it's automatically called bipolar disorder, whether they have the depression or not, because mania and bipolar disorder, they just go hand in hand. Most people will have the depression periods as part of that pattern, but there are a number of people who just don't, but we still call that bipolar disorder. Good question.
So if someone has bipolar disorder, you said during the manic state, they're not necessarily self-aware to know that I'm in a manic state, other than to think, hey, I'm being really productive and I'm getting a lot done, or whatever those thoughts may be. And then when they come out of it, they can feel that the shame for what happened during that time period. Is it only when they're kind of not in a manic state that they can say, yes, I have bipolar disorder, and yes, I need to do something about it?
That's generally what we see. There may be cases, I don't want to overstate, there may be people who say, yeah, I'm definitely in a manic episode right now. Maybe they've had a few of these now and they've gained insight and done work between episodes to try to look for flags or how to understand their patterns a little bit more clearly. But the tough thing with this diagnosis is generally when these manic periods are happening, the insight that something is wrong or abnormal is low, because these states tend to feel very good and they tend to be in line with somebody's goal at that moment.
You already mentioned borderline personality disorder in relation to what it could be if it wasn't bipolar disorder. Are they mutually exclusive diagnoses? Because borderline personality disorder has some of the same components. Can you have bipolar and borderline?
Yeah, you absolutely can. And I've worked with people who do meet criteria for both of those diagnoses. If you want to learn more about borderline personality disorder, you can listen to episode 5 of our podcast. We did a whole podcast on this very important topic. But for people who have both bipolar disorder and something like borderline personality disorder or complex trauma, it's critical that the care team and the individual and their family understand which symptoms are sort of related to which diagnoses. So if somebody with both conditions has a really difficult interpersonal interaction and feels a lot of shame and is really upset over that, we might recommend using skills or other psychotherapeutic approaches to intervene in that shame. But that's very different if they are having a manic episode that's now shifting over into depression. They might need a medication in that case, or even electroconvulsive therapy or something like that if it's very serious, to intervene in that moment. But what we do not want to do is use medication or a strong technique for something that would benefit more from skill-based strategy. And so it is complicated, but we need to be very precise.
It seems like it'd be pretty hard to parse that out, especially if in someone whose life is that potentially dysregulated by all these things going on.
Yeah, it is complicated, but not impossible. That's why it's so important to get connected with a care team, people who understand you, people who know you. If hospitalization is necessary, maybe it's a good idea to go to the same hospital so that people can know you and have a better sense of, okay, what kinds of symptoms are we dealing with at this point in time so that we can be most effective in treating it, and not just using the same approach when a variety of approaches may be most effective.
How many people out there have bipolar disorder?
It's about 1% of the population in terms of our estimates, but it might be higher. These things are a little bit hard to count.
Does everyone who has bipolar disorder, are they eventually finding treatment? Or can you just go your whole life with being untreated?
Unfortunately, there are people who go without treatment, but there are a lot of people who are very successful. They might be public figures or even CEOs or doctors, lawyers, teachers, people who have this disorder, but with proper management and proper insight can be extremely effective, and even leaders, and use some of those gifts that come along with the disorder to their advantage.
You already mentioned that there are treatments out there for bipolar disorder. What are the recommended treatments for bipolar disorder?
Well, because this is a very serious brain condition with actual brain-based activity that is pathological, it does take a little bit more of a directly biological approach to manage it effectively. So often we will recommend medications which are considered mood stabilizers. And interesting, a lot of these medications come from the class of anti-epileptics or anticonvulsant medications that were developed to actually prevent epileptic seizures in people. And so we've taken some of these medications that were developed to treat seizures, and we use them in bipolar disorder to prevent episodes of mania. There's something about this class of medications that calms the brain regions and makes it less irritable and less likely to flip over into this pathological mood state. The other medication we'll use commonly is lithium, which is a salt that's mined from the earth. We don't know exactly why lithium helps with this disorder, but it's one of the most effective medications. And a lot of people who prefer more natural approaches might want to consider lithium because it is, in its heart, a natural element. We'll often, too, use medications that are in the class of antipsychotic, particularly when those episodes have psychosis as a part of it. We'll try to treat the psychosis with antipsychotic medications. Now, talking therapies or skill-based therapies have a role in the treatment of bipolar, but talking or skill-based therapy will not bring somebody out of mania. It really takes medication or maybe even sometimes electroconvulsive therapy or some strong, directly biological approach to sort of treat these mood states. But you can use talking therapy to deal with the emotional, psychological impact of having a serious mental illness. There's a lot of grieving that goes along with that. You can use talking therapy to help improve your insight, to make it more likely that you'll continue with recommended treatments. And it's just good to get support sometimes when you're dealing with all this. Also, there's a type of therapy called social rhythm therapy, where people learn to go to bed at the same time, wake up at the same time, eat their meals at the same time, and keep their social or life patterns very consistent, because there's some evidence that that decreases the likelihood of bringing on one of these mood states. So somebody with bipolar disorder, what we would not want them to do is go to an all-night party, for example, because the risk of triggering a manic episode when you put that kind of stress on the brain and its social or natural rhythms appears to be a risk factor.
So what should a family member do if their loved one is having a manic episode? Do people with bipolar disorder qualify for involuntary commitments? Or is it more of a just you have to wait until you can convince them to seek their own help?
It's a little of both depending on the symptoms. So if somebody is really doing something dangerous, like they think, I have a superpower and I can fly now, and they're on their way up to the top of a building and they want to try flying. I know it sounds ridiculous, but sometimes we see that in bipolar disorder. That's the extent of how the illness can impact the brain. That is absolutely something that's an emergency. You call 911 and they would probably be brought in by ambulance to an emergency room or into a hospital for involuntary psychiatric treatment. And of course, with any of those processes, a court does have to weigh in and say, yes, this is at a dangerous level in order for them to stay in Minnesota in the hospital for more than 72 hours. But if it's short of that, if somebody is just really doing a lot of activity or doing a lot of cleaning or doing a lot of spending or spending time with people they wouldn't usually, and it doesn't reach the level of dangerousness, there's often a limit to what we can impose on people. And so that's where you may want to try talking to the person, saying, I'm concerned, I think something's wrong. Would you please do me a favor? Could we do an evaluation? I'll drive you there. And they still might say no. And if you have someone that you love that has low insight and is not responding, and you've tried talking to them, tried pleading with them, tried everything you can, you may be at a point where you need to get your own support and connect with other families who may be in the same situation and rely on your community to help get you through those periods of time. And that's why I really think so highly of the National Alliance on Mental Illness, because they provide the opportunities for families to connect with one another and do that. And so they're really a resource that I recommend. And if you have a chance, you could even consider contributing to NAMI to help support their mission.
Any last words before we wrap it up on bipolar disorder?
Yeah, I just want people to get a sense of how complex this is. I mean, I think if we look back over time in history, some of mankind's greatest contributions came from people who, in retrospect, might have had bipolar disorder, and in the context of this, did something really wonderful or really great. And I think there's sometimes criticism of the field of psychiatry that sometimes we're trying to intervene in some of those amazing contributions. And I just would love the podcast listening audience to know that that's not our goal. Our goal is to partner with every individual on their goals. And if something's not dangerous, it's always up to them how much treatment to engage in or to take medications or not. And we'll try to talk with them about the risks and benefits and weigh that together, because a lot of these medicines for bipolar disorder are not easy to take. They have side effects and they're difficult, and we understand that. And so it's always an individual decision and an individual discussion, and it's a complicated one that we really try to do our best with.
And for those out there who do want to take Dr. Kaz's suggestion and make a donation to NAMI, their website is nami.org, NAMI.org.
Great. We'll put a link on our website as well.
Oh, great.
TheMindDeconstructed.org.
Oh, yeah, that's our website, TheMindDeconstructed.org.
You got it.
Thank you for joining us today. This podcast was produced by Kaz and George. Music by Paul.
He's the best.
Contact us and send us your questions on Twitter @MindDeconstruct.